Are you constantly hiding your feet because one or more of your toes has a permanent bent deformity? Tired of you feeling the pain from these toes, even when you're doing something as simple as walking? Well, you're probably suffering from hammertoe. It is one of the most common deformities of the toes for women and men. It affects up to 20% of the population at some point in their lives. If you want your beautiful feet back and to be pain-free of hammertoes, you can do something about it. According to our next guest here, I want you to welcome to the show Dr. Hodges Davis, a leading expert in foot and ankle orthopedic surgery. Good morning to you.
Good morning.
Thanks for being here.
It's great to be here.
You know, I was thinking about this. I'm like, you probably have literally seen just about everything there is to see regarding the feet. But what are hammertoes? How do you get them?
Well, hammertoes are specifically to the toes other than the big toe.
Okay.
And it's when the toes claw up, so they literally claw up.
So it's like this?
When the patient stands, yes.
Okay.
And it's a problem because, one, the tips of the toes hit the ground and the tops of the toes hit the shoe.
Oh.
And that can cause pain, it can cause your shoes to be deformed, and it really over time can really be a problem.
Well, what actually, I mean, is it hereditary? Is it just the luck of the draw?
Well, the most common consistent cause of hammertoes are neuropathies, so some type of neurologic problem. But they are hereditary, they are congenital, you can have congenital hammertoes. In addition, sometimes it's just bad luck.
Oh, bad luck indeed. So what are some of the treatment options?
Well, the first treatment we always try is a wider shoe and pads. And sometimes that does work, but the bottom line is we wear shoes. Shoes become a problem, and so the next line of treatment is to fix them with surgery. And in surgery, what we do is we take out one of the joints and we straighten the toes and fix them there so that they're straight when the patient stands and they don't have the pain. Now, traditionally, we have used a contraption called a K-wire, which is a stainless steel wire, and so when we would take out the joint, we would put the wire inside the toe and it would be sticking out the tip of the toe.
So that sounds like that could have some complications,
well,
right? Well,
you know, it's certainly with older techniques, there are complications, and the type of complications that I've seen in my experience are infections to the tip of the toe. The wire can back out or it can go in a little farther, it can bend. And if the wire comes out too soon, or eventually it has to be taken out, in my experience, I've seen hammertoes recur even after surgery.
Oh boy. Well, it really is interesting information. And doctor, I want you to stick around here for a bit, because when we come back, we're going to talk to a woman who found a better alternative to get rid of her hammertoes. You're going to hear her story and you'll meet her coming up right after this commercial break. Welcome back to The Balancing Act. Now, before the break, we heard the story of how the toe deformity called hammertoes and how the traditional method of treating hammertoes called K-wire has many problems. Cynthia Pittman-Osula knows all about these problems. K-wire did not work for her, and so she found a better alternative. Please welcome Cynthia to the show, and she'll be joining Dr. Hodges Davis, a leading expert in foot and ankle orthopedic surgery. Thank you both for being here.
It's good to be here.
Thank you. Thank you, Cynthia, for coming and sharing your story with us. What made you realize that the K-wire treatment was not the right treatment for you?
Well, first my doctor, Dr. Berkowitz, explained what the two procedures were. They had the K-wire procedure and then they had the MiToe implants. And I asked questions about how many patients have you done MiToe on, and then after he explained the number of patients that had the procedure done, I decided to go with the MiToe, and he recommended the MiToe.
You know, I think that's interesting because you asked a lot of great questions, which is what they say we're always supposed to do. What was the alternative that you found, and why did you say the MiToe was the treatment option that you wanted to go
After
with?
he explained the K-wire procedures with the wires sticking out, that kind of made me fearful because it just seemed like the procedure was too complicated, and to have wires sticking out my toes, I just felt fearful of going with that procedure. And then he showed me the little screw that would be implanted, and it just looked like it would be better for me.
Can I ask you a question? How long did you suffer from hammertoes?
I've had hammertoes for about 20 years.
20 years, Cynthia?
Yes.
And you didn't for 20 years? I think it probably was.
The pain
I was going to say.
grew worse over the last 5 years. The hammer toes were so bad that my toes, the bottom of my toes were getting calloused, and that was painful.
Yeah.
And so I was tired of the pain, and my doctor said I can fix those toes.
And I know you were
And I was
happy.
fearful at first.
Yeah.
It took me 3 years to decide, but I finally made the decision that the pain was too much and I needed to do something.
So Dr. Cynthia decided to go with the MiToe procedure, right? How does this treatment work then, and what are the risks with this particular procedure?
Well, the procedure is very similar to as I described with the K-wire.
Okay.
We take out one of the joints, we straighten the toe, and rather than putting a K-wire in, we put an implant. The implant has a screw on one side and kind of a spike on the other side, and so it holds the toe straight, but it's all internal. It's inside of the bone. So it's designed to stay in permanently. No metal is sticking out where it potentially could be a problem.
So you don't have to take it out, it stays in. I have to tell you, she's 5 weeks out of surgery, so it's amazing that you're able to even be here with us today, right, and walk around. How do they know which treatment option is right for them?
Well, the advantages and disadvantages are certainly there with any type of surgery. But in particular with hammer-toe surgery, the advantages of an implant is you can go back to work quicker. You can be out in an open-toed shoe much quicker. In fact, Cynthia, most likely, in my experience, would not have gotten on a plane 5 weeks after surgery because the pins would still be sticking out of her toes. So those are some advantages. Potential problems with the implant are the implant could break, it could back out of the bone. We have done over 10,000 of these in the United States, and those, in my experience, those complications are extremely rare, and we continue to have very, very promising results with this particular implant.
Well, speaking of open-toe shoes, Miss Cynthia has her open-toe shoes on today. Would you mind showing us
I
your
don't
feet?
mind at all.
And you're going to be so surprised. Take a look at this. Look how great her feet look. And Cynthia, I have to tell you, I would never know, ever know you had hammer toes. How do you feel?
I feel great, and I'm so glad that I had it done because my toes were an embarrassment to me, and the pain.
It was the pain, huh?
Yeah, the pain was a motivating factor for me.
And now
they
you're
look
polished.
better.
They look beautiful.
Thank you.
Well, I appreciate you so much for coming by and sharing your story, and I appreciate you, Doctor, giving us all this great information.
Glad to do it.
Thanks to
Thank
both
you
of
for having me.
Well, if you would like to learn more information about hammer toes, visit your local doctor. To learn more about the MiToe treatment, go to the website mitoe.com. That's MiToe.com.